Well, I am Marvin Westwood, a teacher at the UBC, and I'm teaching in the counseling psychology program. I'm a full professor here and supervise not only in our faculty, the Faculty of Education, but I am an associate member in the Faculty of Medicine as well. So do some integrated work there, primarily around now issues of men and trauma, and certainly depression is a large part of that. The question is, when are men most likely to seek help for depression? Unfortunately, in my observations, both clinically and the research that I'm familiar with, they tend to seek help when they're fairly far downstream of being their life is unmanageable or out of control. Most of the men that come to our program, and many of them had military history, they're traditional kind of men, they will seek us out when nothing else is working for them out of desperation. That's one. Or a partner or a spouse may send them. Very rarely of self-volition would they go and ask for help, because that is an affront to the identity of self-sufficiency that many of them uploaded in their socialization. The main difficulty for men with depression, in my opinion, is this. Men with depression are typically socialized in at least this society to not value high levels of reflection or identification of inner self-experiences, let alone they really don't have any social development around attaching descriptions to emotional experiences that they're having. Now, depression is an emotional state. Depression is not an absence of emotion. It reflects, in my mind, a kind of a deficit of complex emotional experiences, of which many of them are not aware of. I am struck by how the gendered socialization of many males, particularly in college populations, which is the focus of the research, still reinforces that kind of admiration for a role definition, which in my opinion will lead to depressive states. Not even necessarily clinical depression, but a moderate level of depression, because they have no access frequently to their inner experiences, hence often lead to acting out or isolation.